Ladies and gentlemen, thank you for standing by, and welcome to the Health Data, Where to Find It, How to Use It webinar, presented by Foundation for a Healthy Kentucky. We encourage you to submit questions via the chat feature, whether joining us by streaming the audio over your computer or by phone, throughout the presentation. Questions will be addressed at the end of the presentation as time allows. As a reminder, today's call is being recorded Wednesday, May 16, 2012. Today's speakers include Joan Bouchard and Sarah Walsh, Senior Program Officers at the Foundation for a Healthy Kentucky. Joan, please go ahead.
Thanks, Lindsay. Thank you all for joining our call today. As you may know, this is the first webinar in the Foundation's 2012 Health for a Change training series. The free multi-part series combines webinars and in-person workshops that are designed to support emerging and established health coalitions doing the important work of fostering change in Kentucky. First, there we go. First, I'd like to begin with an introduction to the Foundation. The Foundation for a Healthy Kentucky was founded in 2001 with a mission to address the unmet healthcare needs of Kentuckians. The Foundation does this through making grants, supporting targeted research, convening key stakeholders, and by providing training and technical assistance through events like this one, as well as providing policymakers with the resources and information needed to make decisions that impact the health of Kentuckians. This year, the Foundation launched a new strategic plan, so if you're familiar with our organization, this part may still be a little new to you. We're narrowing our focus to just two initiatives: promoting responsive health policy and investing in Kentucky's future. These two initiatives will build on what we've learned over the course of the past 5 years, and despite the new names, our commitment to supporting local coalitions with information and training resources will remain. Much of the information the Foundation shares can be found on the Kentucky Health Facts website, which will be the focus of today's webinar, Health Data, Where to Find It, How to Use It, led by Sarah Walsh. Sarah is a Senior Program Officer for the Foundation, and she's the lead staff responsible for the annual statewide Kentucky Health Issues Poll and for dissemination of current local health data via the www.kentuckyhealthfacts.org website. As you can tell, we're having a little bit of a problem with the slides. Before Sarah begins the webinar, I want to remind you of the broader scope of the Health for a Change series. Though the flyer on the slide is difficult to read, you can find a readable copy of the complete training calendar on the Foundation's website, which is www.healthy-ky.org. The Foundation is launching the series this month with 2 webinars demonstrating how you and community partners can find and use the data sources to identify the health needs of your community. On May 30th, Linda Sims from the Lincoln Trail District Health Department, Judy Mattingly from the Franklin County Health Department, and Elizabeth Cobb of the Kentucky Hospital Association will present a collaborative model of community health assessment. Then, during a June 20th workshop, Amy Showalter will provide training on building and nurturing coalitions and networks. Later this summer, webinars will help you identify the differences between advocacy and lobbying, find policies and programs that are evidence-based, plan a budget, and successfully apply for grant funding. The workshops will present how policy is made and promoted in Kentucky, how to build a campaign around your health issue, as well as how to evaluate your efforts for future planning and funding. You can register for any and all of these events on the Foundation's website. With that said, let's dive into the first webinar. Welcome, Sarah.
Thanks, Joan. As she mentioned, my name is Sarah Walsh, and I also work with the Foundation for a Healthy Kentucky. I'm really honored to be here today and able to chat with you about health data, where to find it, and how to use it. I will give you a hint on the where to find it part. That's going to be our data website, KentuckyHealthFacts.org. But I actually want to take a step back from our title for a minute. Perhaps it goes without saying, but before we get into the where and the how, I think we need to talk a little bit about the why we need health data. Oh, the slides are really advancing slow. But Joan mentioned a bit about what we do here at the Foundation and our two new priority areas. Under our previous strategic plan, I worked on an initiative called Local Data for Local Action. I like that this is no longer a specific initiative area for the Foundation, but it's really an undercurrent of all that we do, because it's a pretty good idea. Local data for local action. As a data wonk, it really pains me to say this, but there's really no reason to collect the local data if we're not going to do something with it. And the reality is that we don't have enough time, money, or resources to take action on everything. Our foundation doesn't, our state government doesn't, your community doesn't. I don't know what organization you all are with represented here on the call today, but none of us have enough resources to do it all. So we all need to be strategic with our resources, and we need the data to help us prioritize. What is it we're going to do first? And where can we get the biggest bang for our buck, so to speak? So that's kind of the why. We definitely expand on the why conversation in our May 30th webinar. But let's get back to the where you find the health data. I already gave away the secret that you can find it at KentuckyHealthFacts.org. You will learn a little something about me, and that's that I say KentuckyHealthFacts.org an awful lot, because I'm going to try and get every single one of you to memorize that URL, that whenever you need data, you can go to KentuckyHealthFacts.org. But I also wanted to tell you a little bit about where we find the data that then is put on Kentucky Health Facts. And that starts with these two documents. This is kind of our history lesson portion of the talk. In 2007, the Foundation funded the Kentucky Institute of Medicine to produce the report on the left, The Health of Kentucky, a County Assessment. This report provided a snapshot of the health needs in each of Kentucky's 120 counties and ranked them accordingly. And that was a little bit eye-opening for a couple of counties where, what do you mean we're 117th? Nobody wants to be county number 117. And that sort of brought out some competitive play and interest in really improving these issues, which was wonderful. That same year, we also funded Alan Baumgarten to produce the report on the right. This was the first Kentucky healthcare market report, and that gave us insight into the health resources in all of our counties. Where are we getting our care? How many providers are available? How are we paying for that care? Who are the dominant insurers and communities? That type of information. And really, together, these documents were the foundation for what we launched KentuckyHealthFacts.org with. Because that's really what we want to know in our communities are what are the problems we need to address, and what are the assets that we can build on when we're developing solutions. So what that looks like today, well, those reports are 5 years old, so the data inside them is kind of dusty at this point, but the idea is still good. So we've continued to update the KentuckyHealthFacts.org website under the principles of local needs and local resources. This is just one example on your screen, but it's one we're particularly proud of, and that's our partnership with the Cabinet for Health and Family Services and the University of Kentucky. With this partnership, we have been able to analyze data from the CDC's Behavioral Risk Factor Surveillance System, also known as the BRFIS survey, and I will call it BRFIS because that's a lot faster to say than Behavioral Risk Factor Surveillance System. And what we do is that this partnership got together and talked about a really rigorous and appropriate methodology where we could talk to each of our counties and look at the demographics and the needs and consolidate the survey to produce county estimates. So what ends up happening is that we don't have enough phone calls, because BRFIS is a phone survey, in each county in Kentucky to give us data every year. But if we pool 3 years of data together, we can usually come up with a pretty good estimate. And these are important numbers. This tells us the smoking rates in our community, the obesity rates in our community, how many people are getting flu shots in our communities. So there's a lot. It's a really rich data source, and it's very exciting that we can produce these numbers down to the county level. And I'll get a little bit more probably into what those numbers look like when we look at the actual website. But we've not just continued with the needs, we've continued with the resources. And right now we're partnering with Allison Davis and Michael Childress at the University of Kentucky to update the Kentucky Health Market Report. One component of that work has been these county-level health market profiles that you see on your screen. Dr. Davis and her team at the Community and Economic Development Initiative of Kentucky, or CEDIC, prepared these. And there's 120 of them on the website, and I'll show you how to access those as well. And they really frame access to care from an economic development perspective, which is kind of an interesting approach. But you and I, I'm presuming about all of you folks on the call, but you and I know that access to primary care isn't just good for keeping us well. It really, it can help improve the health of the local economy as well. And sometimes that's an argument that resonates a little bit more with local judge executives or other officials who may not view themselves as working in the health business. Just because I like to think everybody works in the health business, not necessarily everybody takes on that mantle themselves. So this is a way to frame that in a way that's interesting for everybody. So that's just two types of needs and resources that we continue to have. And you're going to see in a couple minutes that we have a lot more information on the Kentucky Health Facts website. And we are so grateful to our partners. What we do at the foundation, we aren't directly collecting the vast majority of this data. It comes from other places, and we're so grateful to the Kentucky Department for Public Health, particularly the Kentucky BRFIS program, the State Office of Health Policy, the Kentucky State Data Center, Kentucky Vital Statistics, the Kentucky Cancer Registry, the Annie E. Casey Foundation, and the Kentucky Youth Advocates on the work they do with Kids Count, and a host of other partners for really making their data available and giving us the tools to make this information readily available to you all. So that's kind of my introductory spiel, but it's not the meat of the website. So let's look at the meat of the website. And hopefully I can share my desktop with you all here, and you'll be able to see this in the real world. Oh, good. That's not the Kentucky Health Facts website. I was playing with it. This is the homepage of the KentuckyHealthFacts.org website. So whenever you type in that URL that I will drill into your heads and you will have all committed to memory by the end of this call, this is what you will see. And the quickest way to get information, there's some highlights in the bottom right as to what's new on the website. One of the recent additions has been the 2008 to 2010 BRFIS data. So we kind of highlight what's new and different as you go through the site, but also this is just your basic navigation page and how to get into the data. So if you are representing a county or you're representing a community, probably the quickest way to find your information is to just click on your county from this map, or you can select it from, there's a drop-down list on the right. As an example, I always like to use Ballard County because I know where it is, just over here on this, on the west-hand side of the state. So when you click on Ballard County, this is what you're going to see, and it's a table of a whole lot of health statistics for health outcomes data in Ballard County. This is specific to Ballard County, and wherever it's available, we provide comparison data for Kentucky and for the United States. It's worth noting that even though I can scroll down here and there's quite a few indicators, this isn't anywhere near all that's on the site for Ballard County. Over in this yellow box where it says topic groups, only health outcomes is selected. We had that be the default for you all because we thought this was a little bit overwhelming. But you can actually select these boxes and just say submit to find the full data profile for your community. And it'll take it a second to load, but you'll get demographic information, social and behavioral indicators. Are we eating enough fruits and vegetables? Are we smoking in our community? Health outcomes. Do we have diabetes and cancer and other chronic diseases? Are there access to care? Are there physicians and healthcare providers in our community? Do we have health insurance in order to be able to pay for that data? Maternal and child health, senior issues. If you scroll down, there will just be a whole bunch of information here that you can find. Another thing that I wanted to point out while we're on the data by location page is the other ways to get information. And down here where it says related links, it will tell you that Ballard County is part of the Purchase Area Development District. So there's some data where we can't get it down to the county level depending on the source, but you can click where it says purchase and then you'd be able to find information to add to this further for the full area development district. Now, one limitation where you have to kind of know the community where you're working is that where it says hospitals within Ballard County, there aren't any hospitals located within Ballard County. Now, if you're from the community, you probably know that in neighboring McCracken County, Paducah does have major hospitals in it, and those are fairly accessible to the folks in Ballard County. So that would be a resource and an asset for that community that they'd want to factor into their planning. But the reality is that it's not located in their specific county, and there's commute times that factor into that. So that's going to be the complete picture of access to care and something you're going to want to look at for your community specifically. But the aside there is that we do have hospital-specific information, and we do have some information specific for area development districts, in addition to what we have for the counties. So that's what happens here on the top. Whenever we click a county like that, this is viewing data by location, and those are the three types of locations we have. We have counties, we have area development districts, and we have hospitals. You can also view the information by topic, and I think it's useful to do that just because you can see things in some different ways. So I'm going to go ahead and click that just so you guys can see a few more of the bells and whistles that are available. Specifically, each of these subtopics, demographics, social and behavioral indicators, etc., I can expand the list and it will tell me what's available. For example, in social and behavioral indicators, we can look at physical inactivity, prevalence of obesity and overweight, fruit and vegetable intake, etc. So I'm going to go ahead and pick obesity because we know that's a major public health issue here in Kentucky. And as it loads, what you immediately see is this slightly overwhelming table for all 120 counties in the state, looking at the prevalence of obesity, the percentage of adults who are obese in that given county. And what you'll see, this is data from the BRFIS survey, which I mentioned. And we provide this data. This is only for the BRFIS survey that we do this, and it's a little bit confusing, so I always like to pause and explain it. We provide this for both counties and county groups. And what that means is wherever it says county data, if we talked to 50 people in 2008, 2009, and 2010 combined, we can report a rate for Adair County, which we did. In this case, 41% of the adults in Adair County are obese, which is alarming. But because we know those numbers can bounce around a little bit, we may have only talked to 50 people or 53 people or a fairly low number in that region for the given years. We also work with something called county groups, and this is the second number that's available. And I'm going to hopefully share a PDF file. You can download this from the website. This is the breakdown, and there's some explanatory text up here at the top that I'll just go over, that the University of Kentucky developed, where if there isn't enough data available for a given county, we still want to be able to drill down a little bit more closely than just what's available for the area development district. So they created these groups of counties that were demographically comparable and geographically proximate. So who are your neighbors that look and have kind of similar health experiences to you would be who your partners are. So we were talking about Ballard County a few minutes ago, you can see that their data, they're not paired with McCracken County. Paducah is a pretty big city. It's geographically right next door to them, but their experiences are going to be a little bit different in McCracken County just because it's a semi-urban area. But Ballard, Graves, Hickman, and Fulton, looking at the demographic data for those communities, we decided they could kind of be buddies. And I hope that nobody from Hickman County is on the phone right now going, gosh, we hate those guys over there. They're nothing like us. Because the data says that this is a sensible pairing, that these communities do have a similar experience. And this 4-county area gives us a little bit tighter view of what's really going on. So going back to the website, we see for Ballard County, their county group, so this would be Ballard, Graves, Hickman, and Fulton County, 29% of the population of adults is obese. And you'll also see a little bit tighter margin of error. That's the numbers in parentheses here for that county group. So we think it's a little bit more reliable. When in doubt, I would just go ahead and use the county group data if that seems unfamiliar to you. And if you're just reporting the Ballard County data, you can just say the percentage in Ballard County is 29%, and that's fine. If you have a question about those two things, I will be happy to explain it hopefully better and in more detail as you get to that issue. But the general idea is we make both of these pieces of information available to you wherever we can. Scrolling down here, you can see that Bourbon County, in that 3-year period of 2008, 2009, and 2010, there weren't enough folks polled, so we couldn't give you a reliable estimate. So this number is just a blank. If we don't think the data is going to be reliable for you, we just won't give it to you, which is where the county groups really get important, because we know that 30% of the people in Bourbon County's county group, and that's going to be pretty close to the picture in Bourbon County. We feel good about those numbers. Another, just while we're on this table view option that's available to you, up here at the top of the screen, it should give you a description of what data it is we're looking at and what time period we're talking about. As we scroll down to the bottom, and there's 120 counties, so I apologize if I'm making anyone dizzy, there will be notes on this indicator to tell you how we're defining obesity. In this case, and this comes from the Burfus survey and the standards that they have, that if you have a body mass index of 30.0 or higher, you're considered to be obese, and you would be factored into this percentage. And then there's a little bit of a description as to where this data comes from and the county group methodology that UK has developed for us. But there's also citation information so that you can, if you are putting together any sort of a report and you need a bibliography, you can list this is CDC and KDPH data from the Behavioral Risk Factor Surveillance System that was analyzed by the University of Kentucky. So we give you those facts to back up any claims that you're making with these data. We try and make that easily accessible. You just have to remember to always scroll to the bottom because we have an awful lot of counties in Kentucky. But going back up towards the top, and just a few other options for you. This is the table view, and if you were interested, there are other time frames. We actually have this data historically since 2003 to 2005. So we have 6 basically periods of aggregated data here that you can compare what's been happening in your community over time. We'll come to that again in a moment. I also wanted to show you all the bar graph feature. This makes it a little bit easier to sort. Right now it's just by default sorted everybody alphabetically. And you'll notice we just default to the county group data here just to make things a little bit more simple. But I can also sort the data by percentage. And I just say submit. And as that loads, it'll tell me who's really in trouble. And that's these counties at the top: Lincoln, Greene, Russell, Garrard, Edmondson, and Adair, where we see 40% of the population is obese in those communities. So you can get a sense as to where your community falls relative to the rest of the state from this bar graph feature. So that's enough obesity data. Let's look at something else that's available. And possibly one of the reasons why we're obese, recommended intake of fruits and vegetables in our communities. This is the percentage of adults. This is, again, data from the Burfus survey. In this instance, we don't ask this question on the Behavioral Risk Factor Surveillance System every year. So to get 3 years of data, we had to combine 2005, 2007, and 2009. So this is a little bit wider time period, but it's the same general structure that you saw with the other indicator. And as before, we had the map available, but we didn't look at that before. And once it loads, this will tell you where we have kind of problem areas and where we're doing better. So you look at, in this case, a low number is of concern, so that sort of ecru, beige, the palest color is of concern, and we see in far western Kentucky and far eastern Kentucky, we're seeing pockets of very low fruit and vegetable intake. The dark purple are the communities with the highest reported levels of recommended fruit and vegetable intake, folks that are getting their minimum of 5 servings per day. And you think you're doing good. You know, in the greater Louisville area, we see high levels, and down here in the southern part of the state, we see high levels. But even there, we're talking about less than 1 in 4 adults is consuming the recommended amount of fruit and vegetables per day. So sometimes just because your county is doing well for Kentucky doesn't necessarily mean that they're doing well, and that's a thing that you need to be mindful of as well. What are these data really telling us? Should we be celebrating the fact that 3 out of 4 members of our community don't consume 5 or more servings of fruit and vegetables per day? And the reason why we are concerned about obesity, going back to the data by topic list, is because of the health outcomes that stem from that. One example would be under chronic disease. I can expand this list and look at the prevalence of diabetes in our community. We know that's linked to obesity rates. And again, the default view is going to be this table, but this is another indicator where we have multiple years of data. So I also wanted to show you the trend graph option. And what this tells me to do is select counties that I'm interested in. So we've been talking about Ballard County, so we'll bring them up again. And how about Anderson, Allen, and Adair, because alphabetical order is easy for me. But when you're looking at this screen, you can look at your neighbors geographically or what an appropriate comparison community is for your community and select as many as you're interested in. I just say OK. And I can adjust the time frame if I'd like, but 2003 to 2008 looks right to me, so I'm going to say submit. And this is what's happening all over the communities. And it's kind of a mess, but you can see what's happening over time. And we've been talking about Ballard County as this blue line, where in 2003 to 2005, 5% of the residents of that community reported that they'd ever been told that they had diabetes by a healthcare provider. That's the full extent of this question, what we're learning here. And that has gone up over time to where in 2008 to 2010, 10% of adults in Ballard County, so frankly that has doubled, and that's kind of disconcerting, have now been told that they have diabetes. And you can monitor that. You know, it looks like, oh, no, that did look like a downward trend for Adair County, but I'm just getting my teals mixed up, where Adair County started at 15% and has bounced around a little bit and is still up at 13%. And it's Allen County that has, again, bounced around but been fairly steady, right around 8%. So apologize for the slightly similar colors there that you need to sort of track where your community is going, but you can see over time what your health challenges are and if you're doing better or doing worse. Because if there's a situation where a problem is getting worse and worse and worse, that's definitely one that should be drawing your attention when you're looking for what to do with your health resources. So going back to data by topic, I wanted to talk a little bit about some of the additional information that's available. Looking at health outcomes again, one of the other options is cancer-related deaths. And this is an age-adjusted rate per 100,000 population, so it's not a percent in this case, but it's the number of people normalized to a standard population amount. We know there aren't 100,000 people that live in most Kentucky counties, but it gives us a level playing field with which to compare. So if I were to look at, this is data for 2004 to 2008. Ballard County, we can see that the rate for all cancers is 205 per 100,000. Now there's a lung cancer rate listed, but there isn't a rate listed for colorectal cancer, breast cancer, or prostate cancer for this time period. The reason they do that is because there's just not enough cancer deaths in that community to provide a stable rate for a 4-year period. Frankly, that is a good problem to have. We don't want to see tons and tons of deaths, but in this case, we don't really know what the colorectal cancer picture is for Ballard County. Again, colon cancer is related to fruit and vegetable intake. We know that it's related to obesity rates. So if we're looking at those types of issues, we may want to dig a little bit deeper and find that information. So one option is we can go down, sorry for making everyone dizzy. Scrolling to the bottom, we see the description of the source that this comes from the Kentucky Cancer Registry, and there is a link to the original data source. So we could go directly to the Kentucky Cancer Registry to find out what else they know about this information. And this is the Kentucky Cancer Registry's website. What's also interesting here is that if there were other types of cancer you were interested in, they also track those. We just kind of pull the leading 4 causes of cancer death and put those on our website. They have incidence data here, and they also have mortality data. So we were talking about mortality data, so I'll click on that. And by default, it's going to, at the frame at the top right, it lets me look at, I can change the type of source between mortality and incidence data. We're going to stick with mortality. I can look at the county. The list of cancer sites that are available on this website is huge. So if you're really interested in cancer, you can dig much deeper into a specific data source, and we can help you do that. But if you're just interested in health in general, we wanted to provide you just kind of that key surface information and make sure you're thinking about cancer with KentuckyHealthFacts.org. But let's look at the colon and rectum. And we had 2004 to 2008. That's the most current data that's available on KentuckyHealthFacts.org. But if we expand that time period a little bit, because it will let us change the time period on this website, which is very nice of them to let us do that, we could say, what about 2000 to 2008? What if we looked at an 8-year time period? And I can redraw this map, and it will have data for me for Ballard County. And by clicking on the word county there, I was able to sort these alphabetically because I don't know where Ballard was in that list. So here I can see that the rate is, they have an age-adjusted rate. That's going to be the rate you want to use. 24.9 per 100,000 adults, or per 100,000 residents, excuse me, in the years 2000 to 2008. So whereas before we didn't have reliable data, we can go to the original source, expand our parameters a little bit, and find more data. A different problem exists with a larger community. If you're in Fayette County, if you're in Jefferson County, you may not need to look at 4 years of data for Louisville and Lexington. There's enough people there that unfortunately there are enough cancer deaths there that we have more, you could look at a tighter time frame. Maybe you don't need to look at 4 years of data. You could look at 3 years or 2 years and still produce a reliable estimate. So we know there's more information available. We want KentuckyHealthFacts.org to be the starting point. We know it won't necessarily be the ending point for you. But with that, this is the Kentucky Cancer Registry. You can Google Kentucky Cancer Registry to find it, or you can find it obviously from our webpage. But I'm going to go back to KentuckyHealthFacts.org so we can look at a few more options there. We've talked a little bit about 2 of these sections of data, the social and behavioral indicators and health outcomes data. Another factor to consider in a community, we talked about those are the needs. Now looking at the resources, and access to care in our community. And I like to think of access to care in two types of ways. One is there care available to me? Is it there where I can go and see a provider when I need to? And also, can I afford to pay that provider? That's kind of the second piece of that photo, or piece of that picture, which is why we have data on healthcare providers and facilities in the community, and there's quite a few. We can look at different types of providers that are available, hospital capacity in a community, as well as insurance and healthcare coverage. Looking at, are there folks who don't have health insurance at all in our community? Are there people who are foregoing care due to the cost, who said, you know, I really needed to see the doctor, but I just couldn't swing the copay this time, or I just couldn't swing that office visit charge, so I didn't go. Who's enrolled in Medicaid? Who's enrolled in different health plans? There's a lot of different information that's here and available to you all. I think most of this is fairly self-explanatory. You know, a flu vaccination in the past year, percent of adults, is the percentage of adults who've had a flu vaccination in the past year. One of the things that's a little bit confusing, or at least is a little bit new to most folks, is these prevention quality indicators. So I wanted to take a moment and explain a little bit about what those are, because that's, I think, a really important piece of data that we have that's kind of underutilized. And these are data that we get from the Office of Health Policy. They're based on administrative records at the hospitals and discharge data. And we have 3 prevention quality indicators that are available. One is the chronic aggregate score, one is the acute aggregate score, and one is the overall aggregate score. And these are risk-adjusted rates per 1,000 adults. And what these are is a measure of preventable hospitalizations. And I'm going to scroll down to the bottom so you can see the explanation, because that will be a little bit more clear than anything I can say. But these are preventable diseases where if somebody had good primary care, if they were being treated for their chronic disease or their condition, they probably would have never landed in the hospital. So the acute score is a composite that includes admissions for dehydration, bacterial pneumonia, and urinary tract infections. So acute issues that could have been dealt with in an outpatient setting that obviously have progressed to the point of someone needing hospitalization. The chronic disease PQI, it's a composite representing diabetes short-term complications, diabetes long-term complications, chronic obstructive pulmonary disease, hypertension, congestive heart failure, angina admissions without a procedure, uncontrolled diabetes, it's a really long list, adult asthma, and lower extremity amputations among patients with diabetes. Really, if you have controlled diabetes, hopefully you won't ever need an amputation. You won't be losing a toe to that condition. So if someone has progressed where their disease is causing them to need that amputation, something went wrong in the system for the most part. So we can monitor these rates over time, and they're a flag as to where we're not getting good primary and preventive care if we're seeing a lot of hospitalizations for these types of conditions. What's neat, and then the overall score adds both of those together. So I think these are really useful numbers, and I think they're numbers we should be paying attention to, but they're maybe a little bit more, there's more that goes into them, so they may not be quite as intuitive to people. One of the options that you can also do is go to the Office of Health Policy's website directly, and if you're just working on diabetes, they have data reported for just diabetes short-term complications. They have a prevention quality indicator score for just diabetes long-term complications. They have a prevention quality indicator for hospitalizations just for uncontrolled diabetes. So you could look at all of the diabetes issues separately if that's what you were focusing your work on. If your work really focuses around asthma, then you could look at just the hospitalizations that were preventable but related to asthma. So that's another way where, like at the Cancer Registry, you can dig a little bit deeper with these numbers directly through the Office of Health Policy website. And I don't have that link on this page, but that's kind of an excuse for me to show you our resources page as well. I'm going to come up here to the top. And these are a list of places, again, where you can just dig deeper on the data. If you're interested in demographics and social determinants of health and those types of issues, the Kentucky State Data Center and the U.S. Census Bureau are really wonderful resources. You can look at the state information from the CDC's Behavioral Risk Factor Surveillance System website, substance abuse prevention information. I'm going to keep scrolling down here because I'd mentioned the Office of Health Policy, and that is under Access to Care. And their data is available through something called Monarch, which is a very fun, well, if you're a data wonk, it's fun. It may not be fun for you all tool. Let me open that in a new window. And that data is available for different years, which is why I don't link you directly to their data tool, because you have to go in through the year you're interested in. And 2010 is the most current, so that's certainly where I would be interested. But this is where you can dig deeper on hospital quality data, avoidable hospital stays, which is what we were talking about with those prevention quality indicators, hospital utilization rates, and county-specific rates of hospital use. So there's a host of information here on how our members of our community are accessing health care, and are they getting the preventive care they need, or are they needing to be hospitalized? So I think this is a wonderful resource, and frankly, there's a whole webinar worth of information on navigating this website. So I'm not going to dig around too deep, but if anybody has questions or interest in that, I'd be happy to show you around sometime. Or Chandra Venadhazi at the Office of Health Policy is wonderful and would be able to help you with this as well. But I'm going to close this out for a second and go back to our resources page. So we're back to KentuckyHealthFacts.org. And just some of the other things that I think are really key. You may have heard about the county health rankings. I mentioned at the start of the call when we were still going through slides that the Kentucky Institute of Medicine was the first ones to rank Kentucky counties according to their health status. And subsequent to that report, about the time we were going, gosh, you know, maybe we should rank the counties again, the Robert Wood Johnson Foundation funded the University of Wisconsin for something called the MATCH Project, Mobilizing Action Towards Community Health. It's right here. To rank all of the counties in each state in the nation. So they continue to do that. And if you're feeling competitive, once it loads, we can look at the County Health Rankings website. And I apologize, it's taking a moment here. But it's pretty intuitive to navigate their website as well. We click on Kentucky, and it will instantly give us rankings of all the counties according to health outcomes. We can also look at according to health factors by selecting that. But health outcomes, this is morbidity and mortality data, what's making us sick and what's killing us in our communities. And Oldham County fares the best. So if anybody's on the call from Oldham County, good job, guys. And Boone County is close on their tail. And they rank everybody all the way down through 120. So if you're in Caldwell County and you're not feeling so hot about 62nd place, you can hopefully implement solutions and move up in the coming years. But this is a good way to kind of attract media attention to your health issues and to bring folks to the table. Because this is Kentucky. We're competitive here. Nobody wants to be 120th. So if you're not doing as well in the county health rankings as you want, that's a good way to start the conversation about your health and bring folks in to look a little bit more deeply at the data and help prioritize what solutions you're going to pursue. So that's one fun resource. But back on Kentucky Health Facts, again, that's a source of data. We have a lot of sources of data. I'm not going to show you all of them, but we also have some great tools for putting together solutions, because it's all well and good to look at a lot of scary and depressing statistics, but ultimately we need to do something with that data. So we want to make sure that you're looking at the MAP project that NACCHO recommends. A lot of health departments are pursuing that to plan a community health improvement. The Hospital Association has a toolkit for hospitals going through a community benefit planning process. So we've got links to some of those ways of how can we make this better. So that's a whirlwind tour of the types of information that are available. I am here at the Foundation, and if there's things I can answer or things that you're specifically looking for, I'd love to help you dig deeper. But I saw this slide earlier this week, and I just loved it so much I had to take it and steal it. But it's this graph of confusion versus information. And if we don't have enough information, we start out and we're really confused. And then when we get a little bit more information and we have the right amount, the confusion goes away. But if I just keep throwing data and data and data and data at you, we just get confused all over again. So our hope is that KentuckyHealthFacts.org will help you kind of land in this sweet spot of information where it's not overload, but it's just the right amount of information for you all and for your needs. But if you find yourself needing more or you want to dig deeper, we're happy to help facilitate that process for you. And with that, I think if I can figure out how, I'm going to stop sharing my desktop and we'll take questions from the audience. Lindsay, while I figure this out, can you tell us how to log a question?
Certainly. Ladies and gentlemen, if you'd like to register a question, please press the 1 followed by the 4 on your telephone keypad. You will hear a 3-tone prompt which acknowledges your request. If your question has been answered and you would like to withdraw that registration, please press the 1 followed by the 3. Alternately, you may use the chat feature located in the lower left corner of your screen. Once again, ladies and gentlemen, over the phone lines, if you wish to register a question, please dial 1-4.
We do have a question on the chat screen. Sean Lindquist asks if the diabetes information includes gestational diabetes.
That's a great question, and actually that comes from the BRFIS survey. So the way they ask is, have you ever been told you have diabetes? And the answer choices are no, yes, or gestational diabetes specifically. So the gestational diabetes is actually excluded from that rate of adult diabetes because we know it's an important maternal and child health issue, but it's not, because it's hopefully a temporary situation, it doesn't really factor into that overall prevalence rate for diabetes in a community. So those are excluded from that data set. Oh, that was good. That was an question I actually knew the answer to. What else is it?
We have a couple more coming in on the chat screen. David Gross asks, what advice do you have when you encounter conflicting data from these multiple sites?
And you're going to see that a lot, whether it's how you rank the counties and what do you mean we're 113th, these other guys said we're 104th, whether it's the specific data points and how the numbers are calculated. You have to look at your source, and generally there's a reason behind the different numbers, and just pick a source and stick with it. We know that the county health rankings that I showed you, they present their data, their BRFIS data. So they'll have a tobacco rate that's based on a 10-year time interval. So they've aggregated 10 years of data together to put their county health statistics together. And on our website, we aggregate 3 years of data together. Both are perfectly reputable ways of doing statistical analysis, but you just kind of have to pick one and go with it. So either use Kentucky Health Facts smoking rates over time, or use county health rankings numbers over time. I think you should use KentuckyHealthFacts.org, but I will own my bias on that. Wherever you get your data, as long as it's a consistent source, you should be able to compare it over time. If it's not from the same place, then there's margins of errors, and it's not that the data are bad, that either data is bad, but it's comparing apples and oranges. So try not to do that.
Thanks, Sarah. There's another question from one from Lynn Sadler, and she asks if we have any data on oral health.
We do. Specifically in our access to care information, we have data on dental providers, dentists available in a community, and licensed dentists. We also have data from the Burfess survey about people who've lost more than 5 of their teeth due to decay. So we track that rate over time. We don't have a ton of oral health data, to be honest, but we do have some information available.
And here's a comment from Mona Huff, a caveat about older people and people with low literacy skills maybe will not answer the phone, and so she warns about not forgetting that those people should be included in the picture, so maybe we have a partial picture of the counties.
That's a great point. And because we've talked a lot about the Burfess survey, that's kind of the most well-known phone survey that happens. One of the things that they're always looking at that of, are the people who are answering the phones representative of the community that we're trying to put data together with? So you'll frequently get a weighted average. Well, they will weight responses back to the demographics that are known for that community. What's happening this year, and again, this is one of those things where you can dig deep and do a whole webinar on it, is people that no longer have landline telephones and only have a cell phone. And I'm one of those people. I don't have a landline telephone. And with a lot of phone surveys, they used to only use random digit dials to landline telephones. So they've had to modify their approach to make sure that we're reaching everybody, because people who only have a cell phone may be different somehow from people who have a landline. So this year, actually, the Kentucky Burfess they've been pilot testing for quite a few years data on cell phone collection, but this is the first year those numbers will be included in the state and the area development district and ultimately the county level estimates. So our numbers may actually bounce around a little bit when the 2011 estimates are released, probably sometime later this month, which is good that the cell phones are being included, but it's just something to be aware of and mindful of. In the future, that may involve web-based surveys. It may involve mailed paper surveys. There's a whole field of research of folks who are making sure that they're collecting the best possible data when they use these different types of methods. So it is always something to watch for. It's a good point.
And there's a question about technical assistance from Stacy Steinbach. She's going to be working with teens, and they'll be doing health projects. She wondered if it's appropriate for them to contact you for help with their data collection.
I'm not really an expert on, well, I guess if they're doing primary data collection and going out and collecting information themselves, that may be something that I'm not the right expert for. But if they're looking at looking to find existing data, and KentuckyHealthFacts.org is a great spot. We'd love to have them nose around and poke around, and if they have questions, that's exactly what I'm here for. There's under the About Us link, or you can reach the Contact Us page, and it's actually at the bottom of the web page. I don't want to open back up the web page for you all, but you can sort of see it on that image of the home page. If you click on About Us or you click on Contact Us, they will find a link that gets them back to me. Otherwise, my email address is swalsh@healthy-ky.org, and I'm happy to talk to any of them. Did we have audio questions? I know we asked for those, and then we didn't go back and check.
We have no audio questions registered.
Okay. Joan, I don't see any other chat questions, so maybe if there are no further questions, I would just say thank you to everyone for listening and for bearing with my whirlwind web tour. I hope you have time to nose around on Kentucky Health Facts on your own, and if I can provide more information, I'd love to do that.
Thank you, Sarah.
Ladies and gentlemen, that does conclude your conference call for today. We do thank you very much for your participation and ask that you kindly disconnect your lines.